Okay, so good afternoon, everybody. As Mark said, I'm Caroline Fowles, and I'm the Education and Training Coordinator for Kent and Medway Pathology Network. And I'm going to talk to you today about my journey as a healthcare scientist within the NHS. So next slide, please, Mark. Has everyone got that next slide? Yep, great. So I'm going to outline what it actually means to be a healthcare scientist and discuss the range of careers specifically in biomedical science. And then we're going to talk about haematology and transfusion, as this is the background of my career. I will then share my journey as a healthcare scientist, which began with entry-level employment within the NHS. I will then talk about how I went on to obtain a BSc in biomedical scientist, become a specialist, then senior biomedical scientist, and obtain further postgraduate qualifications. I will then talk about how I took a career break when my family was young and the opportunities that presented themselves to me even during this period of career step down. So I'll then go on to talk about my current role as Education and Training Coordinator for Pathology and my future plans to train as a consultant clinical scientist. So I'll then finish about some of the benefits of working for the NHS and offer some advice to those considering a career in healthcare science. So next slide, please, Mark. So what is healthcare science? Well, there are over 50,000 healthcare scientists working in the NHS and public health services, and together they provide the scientific backbone of the NHS. Healthcare scientists also enable a world-class healthcare research base, improve patient outcomes, and accelerate innovation. Next slide, please, Mark. So healthcare scientists work in more than 50 specialisms, can be categorized into 4 groupings. So namely laboratory or pathology or life sciences, biological sciences, medical physics and clinical engineering, and bioinformatics. So my background is in life sciences, specifically pathology, and scientists in pathology investigate the causes of illness and how it progresses. So for more information on healthcare science careers, please visit the NHS England and Health Careers websites, where you can take a quiz to find out the healthcare science career that would be best suited to you. Next slide, please, Mark. So to have a career in pathology, you need to study biomedical science. The biomedical science staff mostly work in healthcare laboratories, conducting laboratory and scientific tests to diagnose diseases and evaluate the effectiveness of treatment by analysing fluids and tissue samples from patients. They are critical to the running of A&E, operating theatres, and many other hospital departments, including NHS blood and transplant services. So biomedical scientists provide the engine room of modern medicine, with up to 70% of diagnosis being based on pathology results. So roles in biomedical science vary from identifying outbreaks of infectious diseases to monitoring biomarkers in cancer, depending on the discipline that you choose to work in. So handling over 150 million samples in the UK, every person at some point in their lives will benefit from the services of a biomedical scientist. Biomedical scientists are also at the heart of multidisciplinary teams in healthcare. They provide other professionals with vital scientific information, allowing them to make informed clinical decisions. There are many opportunities for a career in biomedical science within the NHS, and there are currently more than 40,000 posts in England alone. As this is a growing area, there are likely to be many more opportunities in the future. Next slide, please, Mark. So there are several different ways to start your career in biomedical science. Once qualified, you will be registered with the Health and Care Professionals Council, or HCPC. Entry into biomedical science is available via the apprenticeship route. So there is a full apprenticeship career pathway from level 2, which is entry level, through to level 6, which includes obtaining a degree and professional registration. So if you are already a graduate, you can enter the profession as a trainee biomedical scientist. You'll then complete on-the-job training that will require you to complete the Institute of Biomedical Science registration training portfolio in an approved training laboratory. Following completion of this, you will be permitted to register as a biomedical scientist with the HCPC. Biomedical scientist is a protected title, and it's therefore a legal requirement for anyone using the title to be registered. It's important to note that both accredited and non-accredited degree programs in biomedical science are available at different universities, but only accredited degrees enable entry onto the HCPC register. When applying for a degree, please check for the presence of these IBMS logos to confirm that the degree program is indeed accredited with them. Don't worry if you haven't completed an accredited degree program. You could complete the required modules, or top-up modules as we call them, to enable full accreditation. Next slide, please, Mark. So once you have gained an accredited biomedical science degree and professional registration, you can train in one of the following laboratory or pathology specialisms. So I am trained in the specialisms of haematology and blood transfusion. Next slide, please. So haematology and transfusion science is the study and analysis of blood and blood-forming tissues such as bone marrow, and it can be further divided into subdisciplines. So the first one is transfusion, which involves analysing a patient's blood group and providing safe and appropriate blood components. The second is hemostasis and coagulation, which involves diagnosing bleeding or clotting disorders. And the third one, which is my area of interest, is diagnostic haematology, which is where we look at the number, shape, and size of blood cells to aid in the diagnosis and monitoring of disorders such as anemia or cancers such as leukemia. Day-to-day activities for a biomedical scientist working in haematology include performing blood tests, interpreting results and reporting these to the relevant clinician, monitoring the performance of tests through quality control and audit or evaluation of the service, teaching and training of laboratory and clinical staff, and remaining up to date with clinical scientific knowledge in order to introduce new tests to provide the best service to patients. So there's more information available about careers in haematology and transfusion on the National School of Healthcare Science website. Next slide, please, Mark. So now to introduce you to my journey as a healthcare scientist, which I guess really began at secondary school. So at school, I had no idea what I wanted to do as a career. I enjoyed a wide range of subjects, including things like art, PE, and history. So not necessarily science. I did like biology, but I had absolutely no interest in chemistry or physics at all. So I really struggled to choose my GCSE options and restrict my curriculum at such a young age. And although I did quite well, I really got nothing out of classroom learning, and I didn't particularly enjoy school. And I think in hindsight, this was because I really wanted to make my learning real and bring it to life. And leading on from this, I then found A levels really painful, actually. But this was the expected next step at the grammar school where I went to, but they did not really even mention or entertain vocational qualifications. So leading on from A levels, I then started a degree in psychology at the University of Durham. Again, full-time university really was the expected next step at this fairly prestigious grammar school that I attended. But unfortunately, I had dropped out of the course within the first term. And I think this was mainly because I'd really had enough of full-time study and wanted a break. And I really wanted to go out into the workplace with the possibility of learning and developing vocationally. So next slide, please, Mark. So I then decided to go out into the workplace and get a job. And back in those days, this meant scanning the vacancy section of the local newspaper, which shows my age a bit. But I was lucky enough to the role of medical laboratory assistant within the haematology and blood transfusion department at Maidstone Hospital. So I applied for the job and was successful in obtaining it, and went on to NHS pay band 3. So my duties also included phlebotomy. So I went out onto the wards and outpatients to take blood samples from patients. And not only did this give me an opportunity for direct patient contact, it really gave me a good insight into the overall running of the hospital and the complete patient care pathway. So other duties in the role included entering patient details and test requests on the laboratory information management system, answering the phone for specimen reception, carrying out maintenance and running tests on analyzers. And I was also lucky enough to assist our consultant hematologist in taking bone marrow samples from patients. And it was really this consultant who sparked my interest in the profession. So he gave me a bit of preliminary hematology education and also taught me about the hematological diseases that related to the patients that we were seeing. And this really sparked my interest in the profession. And I thought that perhaps training for a role as a biomedical scientist is something that would appeal to me. The next slide, please, Mark. So in 2008, I was successful in gaining a post as trainee biomedical scientist, and I was awarded a percentage of NHS pay band 5 according to my year of training. So this meant undertaking a 4-year BSc on a day release basis. And in the first semester, I also did a chemistry module as I did not have A-level chemistry. So the 4 years involved attending university for 1 day a week and spending the remaining 4 days a week working in the laboratory. So obviously things have moved on. This was nearly 20 years ago, but this is similar to the apprenticeship route that we now have in place today. Next slide, please, Mark. So during the 4 years, I was able to rotate around the various sections of haematology and blood transfusion, and then I was able to gain a lot of hands-on experience and complete my IBMS registration portfolio alongside my degree. So by the time I graduated, I was conducting scientific tests, authorising results and issuing blood products for transfusion. So by the time I finished my degree, I was what we call an oven-ready biomedical scientist. And I was also sufficiently competent to go on call the very night after gaining my HCPC registration. So while there was nothing like being thrown in at the deep end, because this involved working on my own for 13 hours overnight, because of the technical and theoretical training I'd received over such a long period, I really was ready for this next challenge in my career. Next slide, please, Mark. So some challenges I faced while I was a biomedical scientist included the fact that working full-time and doing a part-time degree is no easy feat. So I needed to be motivated to study during evenings and weekends, even when I had been working, and I had to be prepared to use some of my annual leave to study for exams. However, I did not incur any student debt and was able to gain 4 years laboratory experience, and I was also ready to register with my professional regulator as soon as I graduated. And also in addition, and perhaps more importantly, I found that working my way up from an MLA to a trainee and then registered BMS gave a really good insight into the overall running of the laboratory and the importance of everyone's role. And this appreciation is something I have carried forward throughout my career. Next slide, please, Mark. So in 2008, I graduated with my BSc in biomedical science with honours from the University of Westminster. And a year later, I was lucky enough to have my dissertation published in the Haematologica Book of Abstracts. So I spent the next year working as a registered biomedical scientist on NHS pay band 5 in the haematology department at Maidstone Hospital. So as I've touched on, this work involved working autonomously on call, where I'd be expected to identify anything ranging from an acute leukemia to the deadly form of malaria to providing suitable blood products for someone with life-threatening bleeding. So I have several memorable moments from when I was a newly qualified biomedical scientist. So these include one night where I had a patient come in with prolific gunshot wounds with major bleeding. Another memorable moment was when I had a really acute unwell leukemia patient who needed an urgent platelet transfusion. Unfortunately, that afternoon we did experience very severe weather in Kent, which went on into the night, and I think we had 8 inches of snow on the ground by the time I got this request in. So the volunteer drivers had headed up to London to retrieve these platelets for me, but a few hours into it, they got stuck. So the police were then enlisted to retrieve platelets for me in their Land Rovers, but even they were having trouble. So I then was drafted into conversations about whether we should ask the RAF to airlift these platelets to me, as we did have a helipad in the hospital. Fortunately, it didn't quite come to that, and at 4 o'clock in the morning, 2 policemen knocked on the door and handed me these platelets. So another memorable moment was a very severe maternity bleed that I had to manage when I was on my own at night. So a poor lady had had her baby and then had bleeding, which is uncommon. Unfortunately, they were unable to control this, so she was rushed to theatre where they carried out some interventions. And this went on for about 3 hours, where they constantly needed the provision of blood products. And then they managed to stabilise her, so much to our relief, we were stood down. But lo and behold, about 20 minutes later, it all kicked off again as the bleeding had started again. She was rushed to theatre. And unfortunately, this patient did have to have a hysterectomy, but her life was saved and her baby was unharmed. So I've just included this image here as it really does hit home about the serious impact of our work and the professionalism that's required of us during such times. I really hope you can appreciate that this really is a world away from sitting learning science in a classroom at school. So as I really enjoyed working in a hospital environment and the clinical aspect of my role, in 2008 and 2009, I then attempted to gain a place on a postgraduate medical degree course, and I was unsuccessful both times, and I will come back to discussing this later. Next slide, please, Mark. So the challenges I faced as a registered biomedical scientist, including the toll that shift work and night work takes, and the fact that shifts can be stressful, especially during emergency situations where you may have an aneurysm, maternity, or theatre bleed, or perhaps even more than one case kicking off at the same time. So by its nature, work is usually very busy, and as I've touched on, there's usually a lot of responsibility. But I must say, really importantly, that I was really grateful for the support I got from my senior colleagues, that I could even call for advice at 3 o'clock in the morning if I needed to. So when you work in the NHS, your colleagues become your family rather than your team, because most of the time you actually end up spending more time with them than your own family. And it's a really supportive environment where everyone's there to help each other. So another challenge I faced was trying to for my specialist portfolio and MSc around shift work. Next slide, please, Mark. Well, some benefits. So by working on call, I did get days off during the week where I could do my study. And we also got extra money, which is now called shift allowance. And perhaps most importantly, I really got great job satisfaction in working alone and being involved in various stages of a patient pathway, especially those that presented very acutely unwell at A&E and then were subsequently treated and admitted. And one of those stories I'd like to share with you is about a child with acute leukemia. So a very unwell child presented to A&E in the night when I was on call. The clinicians took some blood tests and I soon identified some abnormalities with the child's full blood count result. So when this happens, we then look at the blood smear under the microscope to identify any changes in cells. And I looked at this and was soon able to identify leukemic blast cells that you can see on this background image here, and lack of platelets, or thrombocytopenia as we called it. So not only was I then able to confidently inform the clinicians of this provisional diagnosis, I was actually involved in helping stabilise the patient by providing red cells and platelets so that they would be stable and ready to be transferred to a specialist centre in London the very next morning so that they could start undergoing their treatment. Next slide, please, Mark. So in 2009, I was successful in achieving my specialist portfolio and was awarded NHS pay band 9 and the role of specialist biomedical scientist. So by this time, I had moved to another sister hospital within Maidstone and Tunbridge Wells NHS Trust, as I had an interest in a certain analysis they carried out there called flow cytometry, as I had undergone my BSc research project in this, and I'll talk a bit more about flow cytometry later. Next slide, please, Mark. So I then went on to gain some further postgraduate qualifications, and in 2011 I graduated with a master's degree in haematology with transfusion science, and later that year I passed my BBTS exam and was awarded my specialist certificate in transfusion science. Next slide, please. So gaining these postgraduate qualifications enabled me to apply for the role of senior biomedical scientist on NHS pay band 7, and this was at the haematology department in the newly built Tunbridge Wells Hospital at Pembury, still within MTW NHS Trust. The part of the role included being responsible for the flow cytometry laboratory, which is where I had taken an interest. So cytometry involves classifying blood cells according to their size, internal structure, and antigen expression using antibodies attached to fluorochromes and measuring this with dyes and lasers. So part of the test repertoire included the classification of chronic leukemias, and in doing this, I was also part of the haematology multidisciplinary team for the diagnosis of chronic leukemia. Other tests included monitoring the immune system of HIV positive patients and HLA-B27 typing for association with certain diseases, notably ankylosing spondylitis. So in 2013, I was lucky enough to have my first baby, and I returned to work after maternity leave on a part-time basis. And I really found that this role was too much to fit into a part-time job. So I then decided to have a semi-career break or career step down. And in 2015 to 20, I worked as a specialist biomedical scientist at the Kent Institute of Medicine and Surgery. Next slide, please, Mark. So this was a small private hospital, and therefore the laboratory was small and the work was multidisciplinary. But this gave me an opportunity to learn biochemistry and point of care testing along with some microbiology. So I was also given responsibility for being in charge of the laboratory quality, and I was also required to write the standing operating procedures for biochemistry analysis. So although I hadn't traditionally trained in this discipline, this gave me the opportunity to learn about the technical and theoretical aspects of biochemistry testing. So I was also asked to deputise for the pathology manager in their absence. And although this was a really nice new private hospital to work in, because there was no A&E, so we weren't really seeing acutely unwell patients, from a haematological point of view, the work wasn't particularly interesting. And contrary to popular opinion, the pay in the private hospital was actually less than the NHS, and the benefits weren't as good either. Next slide, please, Mark. So after 5 years, when my family were a bit older, I really felt that I wanted to get back into the NHS, as this was where my heart was, and I was concerned that I was losing my skills in haematology. So I was then successful in obtaining a locum band 6 position within the haematology department at Medway Maritime Hospital. So we all know the year of 2020 as being when the COVID-19 pandemic hit. So poor old Medway was right at the epicenter of the Delta variant, which we all know as being the variant that spread rapidly with severe effects. And this was all before we had developed a vaccine against COVID. So at Medway, we experienced devastating loss of life. We lost 55 patients in a single weekend. But because of the innovative work of medics and biomedical scientists, a panel of blood tests was soon introduced on admission to identify patients at risk of the worst outcomes, notably ITU admission and death. And then we could target the appropriate therapies to those patients most at risk. So at Medway, we also saw some of the first cases of vaccine-induced thrombocytopenia and thrombosis. And as we had very sick patients, the association between thrombosis and COVID soon became apparent. We also saw other very strange things happening with platelets, such as new ITPs, where the immune system attacks platelets and reduces them to very low levels. We're still unable to explain the mechanism behind this. We also saw changes in cells under the microscope, and one that will stay with me was a patient that unfortunately died a couple of hours after having their blood sample taken, and her white cells were literally exploding under the blood film. I'd never quite seen anything like this. So although it was stressful and tiring and quite emotional, I was really grateful and honoured to be part of the NHS response to COVID. So the pandemic was really good in that it raised the profile of biomedical science and diagnostics as a whole. And biomedical science really was at the heart of our national response to COVID. And the work is still continuing. So we have introduced long COVID clinics at Medway, where biomedical science remains pivotal in the study of this novel and ongoing health problem. Next slide, please, Mark. So I then applied for the role of senior medical scientist and training lead, and this meant covering 2 hospital sites, both at Medway and Down Valley Hospital, and this put me back onto NHS pay band 7. So the pandemic had led to the widespread use of Teams, and I was therefore able to deliver haematology training across 2 hospital sites. So my achievements in this role included introducing a programme for morphology training, including slides and lectures. And I was also able to get our first student through her specialist portfolio, as none before had been undertaken within the department. And I'm very proud to say she's now gone on to undertake her highest specialist portfolio, an MSc. And I was also able to expedite 3 trainees through their IBMS registration portfolio in just 8 months, where traditionally this has taken between 12 to 18 months. Next slide, please, Mark. So with this background in education and training, then applied for the role of Pathology Network Education and Training Coordinator, and this was a step up to NHS pay band 8A. So my role now involves writing a programme of e-learning for the IBMS registration portfolio, scoping appropriate training courses for pathology staff, leading on the combined procurement of apprenticeships for Kent and Medway, and leading on band 5 to 6 progression within Kent and Medway across all of the pathology disciplines. Next slide, please, Mark. So now looking into the future, because I do have further opportunities. Career isn't over, because I have been accepted onto the higher specialist scientific training programme for entry in September 2024. So this is a 5-year training programme which I'll be undertaking to include an integrated PhD, RC Path exams 1 and 2, which are the clinical exams which our medical colleagues undertake, and also modules in leadership and management. And completion of this programme will make me eligible to apply for the role of consultant clinical scientist, and I'm hoping to specialise in hemato-oncology. So this will be a clinical role where we'll examine, diagnose, treat, and monitor patients, but also take responsibility for, lead and develop the laboratory service. So this role really is a bridge between the laboratory and clinical roles. So this is a really great option for me for a clinical career progression route, especially after being able to obtain a place at medical school. So there's more information available on this career opportunity at the RC Path and HEE websites. Next, please, Mark. So just to finish, I'm just going to outline a few benefits of working for the NHS. So you're working for an organisation that does so much good and changes people's lives. Your work in one day will have benefited many people who are accessing healthcare. There are always opportunities to improve, as we always strive for the very best standards, and you will be part of a team where every voice counts and your opinion will be valued. There's always opportunities for personal development, and to support this, you will have an annual review and plan to support your career aspirations and access to training courses, whatever your role and pay grade. Working in the NHS gives great job security, and even in my profession, there's a diversity of roles, including senior biomedical scientists, clinical scientists, consultant clinical scientists, and transfusion practitioner. And there's also opportunities to move into quality, health and safety, training and education, and laboratory management. So the NHS also has a fair and transparent pay structure and one of the most generous pension schemes on offer in the UK. You also receive a generous amount of annual leave, and there's support for health and wellbeing, paid sick leave, and access to NHS discount schemes, including for high street stores, holidays, and restaurants. Next slide, please, Mark. So just to summarise, effectively for a university dropout and failed medicine applicant, I don't feel I've had a bad career. And it's not over yet. So thanks to the HSST, opportunities are still continuing to present themselves to me. So I hope this talk has convinced you that while working in the NHS, you can always develop and push to be the best version of yourself. And this is because the NHS recognises that everyone has leadership potential, whatever their role or grade. And I hope this talk will inspire you to take up a career in healthcare science and become a future leader of our very valuable National Health Service.